Well, you just heard John Odgren tell his father that sometimes he wonders, why didn't I use the bathroom downstairs instead? And that's in response to this whole scenario about how it used to be in the 1700s. Just unbelievable situation there. Now, the teenage defendant in this case clearly had a hard time navigating the social scene at Lincoln Sudbury High School, and he often acted out. But was he bullied? And if so, did that contribute to some of his behavior? Let's bring in an expert. Dr. Paul Hokemeyer is a clinical psychologist and attorney, and he's with us now. Dr. Hokemeyer, great to talk to you.
Thank you. It's great to be here.
Now, Dr. Hokemeyer, I want to talk to you about bullying in general first, separate from this case. We've heard a lot about it this year. We've heard about the Tyler Clementi case and the Phoebe Prince case. So many incidents of bullying all over this country. Is this becoming bigger because of the media attention, or has there always been this much bullying?
Well, we've always had bullying in this country and in the world, actually. Anytime you have an imbalance of power, you're going to have bullying. I think that what we've seen from the media is a heightened attention to the issue, which, quite frankly, is good. I mean, I think it's good that we're starting to have intelligent conversations around this.
Okay, and Dr. Hokemeyer, in this particular case, you've got a young man with Asperger's, you've got a young man with some other mental disabilities. If he in fact was bullied in school, how does that then affect his behavior, and would it possibly drive him to do something like this?
Well, again, when we have bullying, we have an imbalance of power, and typically what happens in an imbalance of power is somebody tries to reestablish a power base. So a person who's bullied is going to take actions to try to equalize the differential in power.
Okay. Now, Doctor, I want to take you back to some testimony that we've seen in this trial. One of his classmates, one of John Odgren's classmates, Brendan Piper, talked about being scared of the defendant. Take a listen to this.
You say that you were in fear of Mr. Odgren.
Yes.
Yet, you went up to him and you said to him, "Are you a trench coat killer?"
I did not just go up to him. It was while associating with our group, but yes, I did ask that question.
What was your point in asking him that?
Well, he chased me down a hallway before with a piece of glass, which is considered a weapon. And then I don't know why I asked him that at the time.
Well, that's what I'm asking you. Think about it and try to tell us why you went up to a person who you claimed to be in fear of and said, "Are you a trench coat killer?"
Objection, Your Honor.
Sustained.
You don't remember?
As I said, the 4 times he asked me before, I do not remember.
Okay, now, Dr. Hokemeyer, I just want to, you know, we talk about bullying, and sometimes it includes beating up on kids or doing violence towards kids, but other times it can be in kind of the words that people say. So Brendan Piper right there said he didn't remember saying that, calling him the trench coat killer, but we do know that John Odgren walked around with this kind of trademark trench coat. Does that kind of, well, let me just say this. Would you consider something like that bullying, and would that then have an effect on his psyche?
Well, in bullying, we know that there are basically 3 different kinds of bullying. There's physical bullying, there's verbal bullying, and there's emotional bullying. So it doesn't need to be kids pushing one another. It can be in the things that they say to them, and it can be in more subtle ways of excluding them from social groups. So again, yeah, there's definitely behavior of that sort would definitely fall into the category of bullying.
Okay, Dr. Hokemeyer, at another point in this trial, John Odgren's former history teacher, Nathaniel Armstead, talked about his outbursts in class. I want you to take a listen to this as well.
His spoken words in class were most often on topic. Sometimes they were not. Sometimes he said things which were inappropriate, whether in general or I don't think it was ever really about specific other students, but things which made other students in the class uncomfortable.
All right, Doctor, you know, this is a very tough situation for educators because they're in there and they're trying to manage a class. On the one hand, we want to say, well, why didn't teachers do more? Why didn't they step up and, you know, you see his outbursts. I understand he has a mental disability, but at the same time, could this behavior really be tolerated? Might it have saved a life? But on the other hand, it seems that maybe in some ways he was just speaking out of turn. Can you talk to us about that and whether or not you think based on that kind of behavior, maybe teachers should have taken more action?
Well, I can speak to the diagnosis of Asperger's, which is on the autism spectrum. And basically what that means is that people who suffer from Asperger's have poor social skills. So they'll say things that are inappropriate. They won't laugh at other people's jokes. They won't understand the sense of humor. They don't understand the nuances of relationships. So typically it's something that's not very understood. At the same time, those people who are awkward in social situations tend to be brilliant people. For instance, Mozart suffered from Asperger's. So there's this duality, there's this complication between this innate intelligence and this lack of social skills. So I think what happens is that educators have a hard time specifically diagnosing what's going on. So again, I think the issue here is education. I think it's talking about this particular issue and increasing awareness around it.
Okay, and you know, doctor, you speak about Asperger's there. One of the things the defense is trying to forward here is the idea that his Asperger's, and not just his Asperger's, he had other mental issues, but his Asperger's may have pushed him to do something like this, may have been a reason for him doing something like this. However, is this normally the case with people with Asperger's? We had a wonderful young woman on yesterday who's run multiple businesses. You mentioned Mozart. Is this a mental disability that can actually cause someone, or at least be a contributing factor to someone committing a killing like this?
Well, one of the things that we know about Asperger's is that people lack the capacity to have empathy. And empathy is the ability to understand someone else's position, to understand someone else's emotional position. So again, yes, people don't really understand the social, moral, emotional implications of their actions.
All right. Doctor, one more question for you here. I want to just give you a sense of some of the things we know about John's behavior in school. He brought a toy gun to class at one point. One point he claimed a female student stalked him, brought a knife to camp. He always said that he wanted to feel safe, and that's kind of why he was doing some of these things. But at the same time, we talked about staff again. Again, I don't want to necessarily blame them, but I guess part of the problem that we're having with this case is, given those things, should he have maybe been approached differently? You spoke about education, but at that point, do teachers and staff have to say, hey, we have to remove him from other schoolmates to make sure they stay safe, because he himself is not feeling very safe and he's acting out?
Well, I think you speak to a much larger issue, and that is the state of our teenagers. With that, I have a clinical practice in Manhattan, and I work with a lot of adolescents. And what I see is that there's a real crisis. There's a crisis with our kids. There's a crisis with our families. And basically, we need to be doing a better job as a society and as a culture in terms of taking care of our teenagers and teaching them things like empathy, teaching them things like compassion, teaching them things like morality, and taking responsibility for their actions.
All right, Dr. Hokemeyer, thank you for being with us. And by the way, stick around. You're going to help us take some calls in just a few minutes.
Great, thanks.